Welcome to section 20 of metabolism. In this section, we'll be discussing nutrition. Let's get started. This is the metabolic map provided in section 1 of metabolism. In this video, we're focusing on nutrition, which encompasses many of the pathways seen in this figure. In fact, this figure is a great way to review nutrition because many of the vitamins can be seen on this figure right here. If you've watched all of the other videos in metabolism up to this point, hopefully you've noticed that much of the information regarding nutrition was already covered. So this lecture should be more of a review than new information. However, this video will provide some minor additional details, and we will also review some of the most important points. This table can be found in section 20 of metabolism and provides an overview of the vitamins you need to be familiar with for step 1. We're not going to read every part of the table, but we will go through some of the more high-yield portions together. All of the B vitamins and vitamin C are water soluble, meaning they wash out easily from the body. An exception to this rule is vitamin B12 and folate, because these can be stored in the liver for a longer period of time. Vitamins A, D, E, and K are fat soluble, meaning their absorption depends upon proper functioning of the gut and pancreas. In malabsorption syndromes such as cystic fibrosis or pancreatic insufficiency, the fat-soluble vitamins are not absorbed properly, resulting in some of the symptoms shown in this table. These vitamins are also more commonly associated with toxic ingestion because they accumulate in adipose tissue. Also from the table, notice that vitamins B1 through B5 act as cofactors for many dehydrogenase enzymes. I haven't listed all of these enzymes in the table for the sake of space, but if you look at the large overview map, you can see exactly which enzymes these vitamins are associated with. We've also covered these extensively in other videos. Okay, with this in mind, let's go through the table. Vitamin B1, or thiamine, is a cofactor for many dehydrogenase enzymes, like I just mentioned, as well as transketolase. On step 1, a thiamine deficiency most commonly presents as Wernicke-Korsakoff syndrome, and it's commonly seen in alcoholics. I discussed the syndrome in the section on the TCA cycle, but recall that this is a syndrome that results in a number of symptoms, including memory loss, ataxia, and ophthalmoplegia. Vitamin B2, or riboflavin, is a cofactor again for many of the dehydrogenase enzymes, and it's also necessary for the synthesis of FAD. Recall from the TCA cycle that succinate dehydrogenase converts succinate to fumarate and produces FADH2 in the process. Because FAD is a constituent of vitamin B2, this step in the TCA cycle requires vitamin B2. A deficiency of vitamin B2 can result in chylosis and corneal vascularization. Vitamin B3, or niacin, is a necessary cofactor again for many of the dehydrogenase enzymes, and it's also necessary for the synthesis of NAD. The symptoms of niacin deficiency are also known as pellagra, and these can be remembered with the 3 Ds: diarrhea, dermatitis, and dementia. Niacin in excess can cause facial flushing. This is due to prostaglandins. I also mentioned that niacin is derived from tryptophan in the video on amino acid metabolism. Finally, niacin is associated with Hartnup disease. Let's take a second to discuss this in more detail. Hartnup disease is an autosomal recessive disorder that results in a deficiency of neutral amino acid transporters, particularly tryptophan. And this occurs in the kidneys and the small intestine. Because tryptophan is a precursor for niacin, Hartnup disease results in a niacin deficiency. So decreased niacin results in pellagra, which is characterized by dermatitis, diarrhea, and dementia. Okay, let's do a question. A 10-year-old boy presents with a 3-week history of watery diarrhea. He also has been irritable and has had a pruritic rash during this time. Labs are significant for elevated neutral amino acids in the urine. How would the activity of alpha-ketoglutarate dehydrogenase in this patient likely compare to that of a healthy individual? From the question stem, hopefully you notice that this patient has symptoms consistent with pellagra, including diarrhea, dermatitis, and neurological changes which can sometimes be manifested as irritability. His labs show elevated neutral amino acids in the urine, suggestive of Hartnup disease. As we just discussed, Hartnup disease results in a decreased ability to absorb tryptophan. Because tryptophan is a precursor for niacin, this patient has developed a niacin deficiency. So Hartnup disease results in decreased tryptophan, which results in decreased niacin, which causes pellagra. This figure is from the section on the TCA cycle. Notice that niacin is a cofactor for alpha-ketoglutarate dehydrogenase. That means in this patient, the activity of alpha-ketoglutarate dehydrogenase would likely be decreased compared to that of a healthy individual. Okay, let's continue discussing the table of vitamins. Vitamin B5 is also a cofactor for many of the dehydrogenase enzymes. Vitamin B6 is a cofactor for transamination reactions, cystathionine synthase, and dopa decarboxylase. It's also important for the synthesis of serotonin, niacin, GABA, and heme. Because vitamin B6 is a cofactor for molecules associated with neurotransmission, it should not be surprising that this can result in peripheral neuropathy. You should also know that isoniazid is a drug that can cause vitamin B6 deficiency. Vitamin B7 is used as a cofactor for many enzymes that I've shown on the table, including pyruvate carboxylase, acetyl-CoA carboxylase, and propionyl-CoA carboxylase. Symptoms of this disorder include dermatitis, alopecia, and enteritis. These are pretty nonspecific symptoms and can be found in multiple other vitamin deficiencies. For example, you can see that in vitamin B5 deficiency, patients can also have similar symptoms. It's high yield to know that avidin is a component found in egg whites, and it binds to biotin. So biotin can be deficient in individuals who consume an extraordinary amount of egg whites. Folate and vitamin B12 are some of the most high-yield vitamins you need to be familiar with. However, we discussed this in great detail in the video on homocysteine metabolism, so we're not going to spend a lot of time on it now. You should know that folate is converted to tetrahydrofolate and is associated with nucleic acid synthesis, homocysteine, and methylmalonic acid metabolism. You should also know that vitamin B12 is a cofactor for methionine synthase and methylmalonyl-CoA mutase. Both of these disorders can result in a megaloblastic anemia, so they need to be distinguished based on their laboratory findings, which is shown in the table right here. Folate is found in green leafy vegetables, and B12 is found in animal products. Vitamin C is associated with collagen synthesis, and a deficiency can cause scurvy, which consists of swollen gums, petechiae, and poor wound healing. This can be associated with individuals who are unable to consume enough fruits and vegetables. Vitamin A is associated with vision and the normal differentiation of epithelial cells. It's high yield to know that excess vitamin A can cause increased intracranial pressure and dry skin. Vitamin A-derived medications such as isotretinoin and all-trans retinoic acid can be used to treat cystic acne and APL. Vitamin D is discussed in great detail in our physiology videos, especially in the endocrinology chapter, but very briefly, it's involved in the regulation of calcium and phosphate, and a deficiency can cause rickets and osteomalacia. Vitamin E is an antioxidant and is important for protecting red blood cells from free radical damage. A deficiency can result in anemia as well as neurological deficits. Don't get this confused with a vitamin B12 or folate deficiency. The anemia is different because it's not macrocytic. In other words, the MCV will be less than 100. Vitamin K is important for clotting, and a deficiency is associated with neonatal hemorrhage. Notice that it is also produced by colonic bacteria. This is why neonates who have a sterile colon are given vitamin K injections, which helps prevent neonatal hemorrhage. Finally, zinc is not shown on the table, but you should know that zinc is associated with enzymes that bind to DNA. Okay, let's do a question. A 55-year-old male with a history of heavy alcohol and tobacco use presents to the physician due to a 3-week history of unstable gait, numbness and tingling in the extremities, and generalized weakness. Physical examination reveals ataxia, decreased proprioception, and bilateral weakness. Stool analysis reveals an increased fat concentration. CT of the abdomen shows a mass concerning for malignancy. Which of the following is most likely deficient in this patient? Hopefully from the question stem, you notice that this patient has a history of heavy alcohol and tobacco use. Later in the question stem, we're told that a stool analysis reveals an increased fat concentration. We're also told that a CT of the abdomen shows a mass concerning for malignancy. These components of the question stem should make you think of pancreatic failure, resulting in fat malabsorption. Alcohol and tobacco use are risk factors for pancreatic cancer, and pancreatic cancer is a potential cause of fat malabsorption. From the available answer choices, you can see that only vitamins E and A are fat soluble. The rest are B vitamins, which are water soluble. A vitamin A deficiency commonly presents with vision problems, and a vitamin E deficiency commonly presents with anemia and neurological deficits. From the question stem, we can see that our patient has many neurological deficits. So the answer is vitamin E. Again, don't get tricked up by B12 and folate. These can also cause neurological deficits and can present very similarly, but these are water-soluble vitamins. Vitamin E is a fat-soluble vitamin. Finally, pay special attention to the stool in questions like this. If the question is hinting at a fat-soluble vitamin deficiency, it will usually say something about fat in the stool. A very commonly tested disorder that can cause this is cystic fibrosis. From the table, notice that vitamin E can cause anemia and neurological deficits. And as we discussed at the beginning of this lecture, vitamin E is a fat-soluble vitamin.